Welcome to another edition of Thought Leaders Live, where we talk with thought leaders in business, life, and all points in between. I think we've got a little bit of an in-between here in terms of we're going to be talking a little bit about healthcare with Dr. Lauren Marasa joining us, who is the CEO of NorCal Neurostimulation. Dr. Marasa, thank you so much for joining us today.
Thanks for having me.
Yeah, we're going to talk about advancing mental health treatment, and specifically, we're going to get into transcranial magnetic stimulation, TMS. So I'm really excited to jump into that and talk about how it's helping patients with depression, anxiety, OCD, other conditions. And it's a non-invasive procedure, so I'm really looking forward to it. But Dr. Marasa, before we do that, tell us a little bit about your own personal story and how you and the kind of the genesis of NorCal neurostimulation.
Yeah, so I'm a double board certified general and forensic psychiatrist, but I never thought I would be a psychiatrist growing up. I've always been interested in neuroscience and the brain, but growing up, I wanted to work for the FBI. I wanted to do forensics. I wanted to be the person that found the hair that matched the the suspect.
Right.
And so I started off majoring in forensic chemistry and working in a lab, and was like, this is not like TV. I want to interact with people, interview people, talk with people. And so kind of following my interest in neuroscience, I went to medical school and really, really loved neurosurgery and just the changes that, we could make on people's lives. Specifically, I got interested in functional neurosurgery, which is where people actually have brain surgery implants made in their brain to help a variety of conditions to improve their quality of life, whether it's their tremor for Parkinson's disease or even brain surgery for depression, severe depression, or OCD.
Wow.
And so I started my residency. I did my medical school at University of South Carolina, did my residency in Kentucky. And a few years into my residency, I started hearing more about TMS. And I was so curious, what is TMS, transcranial magnetic stimulation? And I started learning about this treatment that can basically rewire the brain without surgery. And, residency is no walk in the park. I had 2 children at that time, and I started going, well, who does these treatments? And it was psychiatrists that were really involved in this treatment modality and in this field. And on top of that, as a neurosurgery resident at the time, we were treating brain injuries and essentially saving lives. But I was seeing like all of the psychiatric like sequelae and outcomes with patients once they left the hospital. The psychiatric manifestations of brain injuries, of concussions, chronic traumatic encephalopathy was becoming more talked about with multiple concussions from sports injuries. And I started just really getting more and more interested in this field. And so ultimately, I decided to make the switch to psychiatry and started my residency journey over in psychiatry with the goal of, one, becoming really an interventional psychiatrist, which is kind of this new niche in psychiatry that we can talk about. And 2, I learned that there is a forensic psychiatry niche. And so I moved to California to do a fellowship at UC Davis in forensic psychiatry, which basically kind of comes full circle for me to combine everything that I've kind of had interest in.
What is forensic psychiatry?
Yeah. Forensic psychiatry is pretty much anything that deals with mental illness or brain injury and the law. So there's kind of 2 different branches. There's the criminal side, which is going to be those evaluations of, was that person insane at the time of the crime? you know, people may have voices or things telling them to do something which may or may not be insane or what we call malingering. We evaluate, for exaggerating or feigning mental illness. Other kind of bread and butter forensic criminal cases would be like someone's capacity or competency to stand trial, if they're in a psychotic state or um, disabled in some way. And then there's the civil side, which could be anything from I have depression or PTSD from a car wreck, or I've seen so much bad stuff as first responders, to fitness for duty. Can I um, practice my job safely, or let's say carry a weapon if I'm in law enforcement or something based on some history? You could even do evaluations after the fact, psychological autopsies. So
Hmm.
that's where you would evaluate someone. A lot of times it comes down to insurance claims. Was it a suicide or an accidental death,
Okay.
or another, or people that may contest like someone's will. So like
Sure.
testamentary capacity. So
Oh,
it's a huge range of things involving like brain and law.
okay. Well,
Yeah.
fascinating.
Yeah.
Okay, so thank you for the bringing us up to speed on your own personal journey. And you started the clinic. Fantastic. You're in Northern California. Let's talk about TMS and what it is. Why don't we just start out there with just this kind of how does it work and why is it being used for depression, OCD, and other related conditions?
Right. So when I started learning about TMS as a neurosurgery resident, I started seeing that with TMS, the results could be just as really remarkable and life changing as those who actually got surgery. And so TMS, transcranial magnetic stimulation, is what one of the treatments my clinic focuses on in this neuromodulation specialty, which basically means we're stimulating the brain right at its source. And this is all kind of based on the use of what's called neuroplasticity. And neuroplasticity is kind of how we can rewire the brain. So TMS uses a magnetic coil. We place it on the head, and through a series of magnetic pulses, it generates an electromagnetic magnetic field, and essentially that causes your neurons, your brain cells, to fire. So we start activating systems that are underactive in depression or even overactive in anxiety or OCD. We can basically push on the brakes, or sorry, push on the gas to kind of stimulate those areas, or even press the brakes to inhibit certain brain circuits. And so it's a very specific, targeted approach to treating mental illness.
Wow, that's fascinating. Now, I work with, I would mention to you before the show, a developmental optometrist who does a lot of work with the brain plasticity and the visual system and retraining the visual system and how to work correctly. And typically, once it's retrained, it stays. Is this when you use TMS and you kind of do the rewiring? Is that kind of like a permanent shift? What how does that work?
Yeah, so TMS, it's not a one time treatment. It is most, the standard protocol would be doing a treatment once a day, Monday through Friday, and typically it's for 36 treatments. So it could take 6 to 8 weeks to complete a treatment course. Each treatment, there's treatments that last from about 3.5 minutes up to even 40 minutes, depending on what we're trying to accomplish. But most commonly, it's about an 18.5 minute treatment where patients drive to and from to get this outpatient treatment done in an office setting. So there's no anesthesia, there's no downtime. We're basically literally stimulating the brain at its source, and then patients go on about their way. And I attribute it a lot to exercise or physical therapy. It's not like you just go once and then things are better. The consistency is the key, right? So your brain, sometimes, I'm going to back up for a second. you know we traditionally think about psychiatry, or at least I did in medical school, with medications and psychotherapy.
Right.
And it's like, well, what happens if that doesn't work, because just statistically we know that medications will not work for at least one third of people for depression. That's a pretty big number.
Yeah.
um, and so that's again where the TMS or even other treatment options come in. So TMS, we typically in medical school we were kind of taught that depression or mental illness is this chemical imbalance of the brain, and that's again how medications are made to work. But again, it doesn't work for everybody. So as I've gotten more involved in these interventions, I've kind of seen that the way I think about mental illness is differently now, and depression and bipolar and schizophrenia, and it's almost like an arrhythmia of the brain. And
Mm.
people think about heart arrhythmias, and they think about fatal heart arrhythmias that you can see on an EKG. And in severe cases, you have to shock the heart back like you see on TV, right?
Right.
Well, same is true with mental illness. So back in the day, the oldest biologic treatment we have in psychiatry is ECT, electric shock therapy.
Right.
And in severe cases, you still put two pads on and shock reset the brain through a seizure. And it causes a full-fledged seizure with ECT, but TMS is much more advanced than that, where there's no seizure. And instead of kind of doing a full brain reset with the associated side effects and anesthesia and all of that, we can literally target it at its source directly, right? Instead of this broad throwing something against the wall and hoping it sticks kind of thing. And so when I use this kind of analogy that the brain's almost an arrhythmia and we have to get it talking right again and reset it to fix those neuron pathways. We say that neurons fire together, wire together. So we basically are reconnecting the system.
Mm.
Your brain is most like when people have lived in the state for a long time, the brain wants to go back to that default mode, like what it's used to.
Right.
And so through a series of treatments and consistency, you're going to keep reminding the brain that no, we're trying to reroute the wiring, we're trying to reroute the path or the network, right? Or sometimes I'll say we're kind of like dig that tunnel in the sand deeper so it's more permanent, right? So typically it's 36 treatments. And I will say that it does take usually a few weeks to start working.
Yeah.
Some people notice the effects more quickly than others, but typically it takes 10 to 15 treatments or so for people to start feeling an effects. But on the flip side, the durability and again, how long it lasts is much better than other treatment options. And so we don't exactly know for every person how long it'll last, but generally speaking, 2/3 of people stay well at 1 year out. And so there's a lot of things we can do to kind of enhance like how long it lasts.
Okay. So 12, what was that? 12 months? And then maybe the treatments need to begin again?
Yeah, so some people, I've had patients that have done this treatment 10 years ago and are still doing very well. I've had patients that, 5 years ago, 1 year ago, and I have some patients that have to come back for a repeat course.
Sure.
Some people need a little booster series, some people will do maintenance. It just depends on the case, right?
Right. So give us an example of, and we talked about this before, of a patient who was suffering from a mental illness and how it helped him.
Yeah, so when you asked me that, my brain went through like a Rolodex almost of multiple
Yeah.
different options. TMS specifically is FDA cleared for treatment resistant depression, anxious depression, and OCD. But in reality, a lot of times people will have comorbid conditions. And so one patient of mine kind of popped in my head. He was a 50 something year old homicide detective, retired. And he would tell me stories about just some horrific things he had seen in his past, and really I would say developed some post traumatic stress disorder from that career. And as a result, he started drinking more alcohol to kind of numb the pain, and which just worsened depressive symptoms. And so he came to me in his attempts to stay sober on very high doses of antidepressants, and we started TMS. Um, the TMS has a very rare chance of having a seizure during the treatment. That should just not happen, but it's what, 1 in 30,000 or so. So, one of the things that we ask patients every day when they come in is, have you had any changes in your alcohol, your sleep, things that may increase someone's seizure risk? So, for him, part of coming in every day was the accountability of staying sober, which is in and of itself a helpful thing for depression. But then we actually started treating the depression. He got remarkably better. I got his doses of medications. I think he was on Paxil 70 milligrams, which is way above the recommended dose, down to 10 milligrams. We weaned
Wow.
it down. And then by the end, he said, I'm feeling so much better. I want to become a psychiatrist now and go do these treatments. And
Wow.
so then you look at, well, is this patient getting a little too good, a little manic? But at the end of the day, I believe he ended up going back to school and becoming a therapist.
Oh, okay.
Yeah, so to help others in this field.
Yeah, you got to be careful you don't cure them too much and they become competitors for your business. Well,
You
that's
tire
really,
them.
yeah, that's really a fascinating story. And there's other related conditions, right? There's anxiety, OCD,
Hmm.
um, all these different treatments. And I'm assuming, just your knowledge of the brain, because I think obviously when you say chemical reaction, people are like, can kind of make that connection pretty easily. Like, okay, yeah, I've got too much of this in my blood. So I get how the drugs work. This with TMS, it's your knowledge of the brain and the different, I'm assuming the different areas in the brain that you're stimulating. And I'm always kind of like, how did they get to this point? Like you mentioned the earlier shock treatments that we used to see, and like One Flew Over the Cuckoo's Nest
Uh-huh.
and stuff. How did
Hmm.
we get to this point, and how does it work, kind of logistically?
Well, I would think a lot of researchers before me that figured this out.
Yeah.
There's been a lot of, this is not TMS, even though it's widely unknown, and which is one of the reasons I love talking to you and these and doing these types of things, is to spread the word. Talk about the latest treatments that we have, other than what people typically think of. But TMS has been around for some time, and again was FDA approved in 2008. And as even since then, more and more indications are coming out to where I feel like we're just on the cusp of what is to come with TMS. Because, like you were saying, having knowledge and through research and MRI studies and a lot of smart people doing this work in the background, we do know what circuits of the brain are involved in different, um, you know, they do different things, right?
Yeah.
So we know that the treatment target for someone who's struggling with OCD is different than someone who's struggling with depression. Um, but there's so much more in the works, from treating patients for addiction, for pain. I have a patient currently, we're treating him for his tremor for Parkinson's because he did not want deep brain surgery. Um, and he has a little test that he does to see how his tremor is doing, because he walks with a measuring cup with water and sees how much spills out as he goes, and that's getting drastically better.
Right.
These are off-label uses, but we're just on the cusp of really what all we can do with this non-invasive but very targeted brain stimulation.
Well, let's talk a little bit about, you know, interventional psychiatry and neuromodulation. We've got probably about 12 minutes left. And I don't know if we want to get into that a little bit, or really where you see all this is kind of headed with psychiatry.
Yeah. So, um, when I think about TMS specifically, um, the response and remission rates are statistically better than medications for the majority of people, depending on typically how many medications they may have tried or failed or couldn't tolerate. But TMS specifically has um, response rates of 50 to 70, even in some studies 80%. which
Wow.
means they have to have at least a 50% improvement, and
Wow.
remission rates between 30, 40, even up to 60% in some studies of remission. So what I wanted to say is that remission is the goal. And back in the day, I feel like we would accept partial remission, like, oh, I'm not feeling terrible, but I'm feeling okay, or I'm hanging in there. And it's like, well, is that really good enough? Like, that's really not the goal. Not at this point. The goal is remission, to have, an improved quality of life. We kind of use these terms like cancer treatments, that there's no set cure for some of these things, but the goal is remission, which means that you are symptom free for as long as we can keep you symptom free. And so I think that we're much more targeted on the remission being the goal. And we're also looking at ways we can really personalize the treatment plan, again, just like someone going through cancer treatments, which is we're looking at studies of biomarkers of personalizing the care of what treatment is going to be best for you. And whether that's TMS or Spravato, which is an intranasal ketamine treatment. So we're kind of really looking at how can we figure out what's going to work for each person. Um, and then again, like I said, TMS is just, I think, getting started on everything we can that's going to be able to do.
Well, I'm glad you brought that up about personalizing because, thought occurred to me that I hear this a lot from people who have ADHD or OCD, and they're like, I don't like taking the medication. I don't like how it makes me feel. Feel numb. And I compare that to me, for me, with TMS. And then do you have cases where it's kind of like medication, where maybe you're doing some treatments and they don't like how they feel?
So the the side effects that you mentioned with I feel numb, I don't like how I feel on the medications. I mean, we hear that a lot, right? And it used to be, before the days of interventions, what's the trade-off, right? Like the
Yeah.
side effects or the underlying problem. But it doesn't have to be that way now. The TMS treatment is, again, it's a non-medication, non-invasive treatment. So there's no systemic side effects. Some people may report a little headache the first few days of kind of getting used to the sensation. But otherwise, it's very safe and very well tolerated. And so some patients will continue medications with TMS, and some patients will have no medications or will get off their medications eventually after TMS. Um, but the TMS, I really can't think of off the top of my head anyone who feels like it made them any worse, right? Like the
Hmm.
goal is getting better, and even as great as TMS is, it's not 100%, which is where the personalized options are going to be a game changer. But most people report only improved side effects. So even if we're treating the depression protocol, which is the most standard one, treats your prefrontal cortex. If you think about what does the prefrontal cortex do, it is involved in kind of your executive functioning or your decision making, your planning, your thinking. And so people will tell me all the time, I'm thinking more clearly now. Um, their ADHD is getting better because they're less impulsive. They're thinking through things better. Um, the other thing that they report a lot is, you mentioned kind of the eyes, and people will report seeing brighter colors. They'll say the grass is greener and the sky is bluer, the fog's lifting. And it's
Wow.
like that actually happens because even though we're stimulating one specific area, the brain's so connected that you'll actually see in studies the brain lighting up all over. So they'll say, music sounds sweeter to my ears, or my perfume smells stronger. And it's because you are stimulating essentially multiple areas of the brain by the different connections. And so if anything, people will just report like these added benefits. So improved memory. I've seen many patients who have kind of mild dementia, mild neurocognitive disorders, mild brain injuries, getting better with like the standard TMS protocol.
Wow.
Hmm.
Tell me what you think, how this is going to influence or impact the field of psychiatry with, as you mentioned, all the medications that are prescribed. And I'm kind of curious if you're getting some pushback from the field from a lot of people who don't maybe who are in the field and maybe don't understand TMS too much and are because I've seen this in optometry with developmental optometry where some people don't quite buy into the brain's plasticity and don't get how it works, and it seems like kind of a territorial reaction. Tell me about the future of psychiatry, and are you getting any kind of pushback from colleagues?
Well, I would say some people, are very set in their ways of what they were taught and may want to stick to what they're doing. But at the very least, I think it's just good to get educated. Sometimes I hear people who might say, like, well, that's not going to work, or dismiss something before they've even had a patient try it, or really are informed about it. Even when I started, I'll tell you, when I started, I heard about TMS, right? I was learning about it, but I had to be convinced myself that this was going to work. And it wasn't until I had my first few patients that, please work, it works. And um, again, going back to the neurosurgery days, I had a patient with a brain injury who had TMS, and she was able to drive again, which she wasn't before. And, one of my first patients I treated for depression was a nurse who had just been out of the hospital for suicidal, bad thoughts. And she got in remission. And so until you kind of see it to believe it, then I think you become a believer of, wow, this is not like voodoo. Like, this is real evidence-based science.
And you mentioned science. I mean, we're talking a lot about helping people with mental health treatments. And, obviously there's a lot of behavioral treatments out there, which is really important. Are you seeing more science-based mental health treatments enter the picture? And do you think this is going to kind of reshape the playing field a little bit?
Yeah, definitely. Absolutely. There's various other treatments we didn't get into using EEG and neurofeedback and various other things that are out there, not just TMS, but TMS is really effective alone or in conjunction with other things. And so I do think that the field is, with these treatments, we are, less just kind of, I don't want to say touchy feely, but we have specific proof of what can help what, like very more specific. And oh, there was something else I was going to say and I can't remember. Um, but I definitely think that the future of psychiatry is just exciting. It's just getting started. And I remember what I was going to say. Back in the day, again, you mentioned One Flew Over the Cuckoo's Nest and ECT and trying to reduce all of that stigma. Psychiatrists, people still say it's my shrink, and that really came from psychiatrists being kind of there was thought that we would like shrink the brain with these treatment
Yeah.
options, and in fact, it's the opposite. With these treatments, we release a growth factor of the brain that creates neurogenesis, or the growth in new neurons. And you actually can see brain volume growth on scan. So if anything, it's quite the opposite. We are like growing the brain.
I like that.
Yeah.
That's good. And uh, kind of a flippant question here. Can you use TMS to change the mind of the skeptics? Have you tried that yet?
I guess they're welcome to come sit in my chair and see how they feel.
Oh, that's funny. Um, One last question then. Do you pair this with kind of the behavioral psychology? I mean, do you see the two kind of working together in any way?
Sure. So we talk a lot about, with TMS treatments in my clinic, what will make it work best and what will make it last the longest. And whatever you do in your day-to-day life, your neuroplasticity is taking effect: exercising, eating right, so therapy. And so whatever you're doing, you're kind of priming those pathways
Yeah.
yourself. and then we are just amplifying it, right? So I definitely see great outcomes when we combine behavioral interventions with TMS. And we're really big on that in my clinic as far as goal setting, exercise, diet, therapy, because again, that's just going to help extend that durability even longer.
Wow, this is really exciting. I'm really happy you came on the show and enlightened me, and I'm sure many other people watching this. So thank you so much, Dr. Marasa. If somebody wants to work with you and wants to learn more about TMS, how did they do that?
Yeah, so we have a website. Our clinic website is www.norcalneurostim.com. We have an Instagram page, and all of that contact information for me or my clinic is on those sites.
Right. And we'll put a link to it in the comments of this LinkedIn Live. So thank you so much for joining us today, Dr. Marasa.
All right. Well, thanks so much for having me.
And thank you, everyone, for joining us on another edition of Thought Leaders Live. We'll catch you on the next.